Hi, my name is Hadas Ben-Mayer, and I am a first-year occupational therapy student at Midwestern University. Today, I am going to share with you an occupational-based kit for our Analysis 1 class. The kit that I decided to do is medication management because I think it is very easy to forget to take our medication or to forget if we've taken a pill. Our days are so long. So it's so easy to forget if we've taken it or when to take it. So I decided to write a few steps out that I think are super important in maintaining your medication and making sure that you can take your medication on time every day and you make as little mistakes as possible. I do want to say that each step is a choice, so the steps that work for me might not necessarily work for you. They're just merely suggestions, and you can change it up if you'd like. You can add, you can take things out, make it personal, make it what works for you. Nothing is set. So one thing I also want to suggest is a lot of the times we have to take medications AM and PM, so keeping your medications maybe in your bathroom. If you we all brush our teeth twice a day, morning and night, so keeping our medication close to the sink in the bathroom might be beneficial to you if your medications don't need to be refrigerated. And just adding your medications to your everyday activities and your everyday routines could make it a lot easier to remember taking your medications if you have a hard time remembering, like most people do. So in my occupation-based kit, I have everything neatly organized so I don't forget to take, or anyone won't forget to take if they have trouble with sequencing and timing throughout the day. So one thing I have that's really important in the occupation-based kit are pill sorters. I have this one. This is for AM, and then this is for PM. And it wasn't included on here, so I decided to write them in so I don't forget. Some people have different medications for days and for nights, and it is very easy to remember. So having a list of the medications that you take per day and per night, and then at the beginning of the week sorting them out so they're all ready for you throughout the entire week, so you don't have to do them per day and get confused. Something else that I think is super important for timing and sequencing is to have a medication sheet. And in this specific sheet, you have the name of the medication, the dosage that you're taking, how many you're taking per day. And I think it's really important to also add the time if you need to space specific medications out. Let's say you need to take one at 7 a.m. and one at 7 p.m. You can write the exact time that you've taken your pill. If you need 12 hours spread out, if you need 7 hours spread out, it can really help you in remembering the time that you took it so you can make sure that you're within the time frame that you need to take the medication. Also, what I think is very confusing, that could confuse anyone, is 2 S's and 2 T's. So for Sunday, I put sun, and for Thursday, I put a TH to differentiate between Tuesday and Thursday and Saturday and Sunday. And I did that on both. So what I also have in my kit is a cup for water. So if you do it by the sink, you can fill it up with water, or you can go and keep a bottle of water in here, whatever works for you to make sure that you have water to take your medications with at all times. And if you prefer to drink your water with a straw, I have a straw in here. It's whatever is best for you. Also, what I thought is really important, for example, with someone with arthritis, is to make taking pills as easy as possible because it can be painful or really hard to open up any of the medication bottles that are given to us through the pharmacy. So these bottles I think are easy for me, but what might not be easy for you, you push it down and you just twist off, but that does take a lot to do. So if these aren't easy for you, I also think it's really important to put it in these. You can just pop them open, do it with your whole finger, you can do it with the tip of your finger. you can figure out the easiest way for you to open these. That way you're not really limited with this. So I think that this is also very important for someone who has trouble with opening and closing their pill bottles. Yeah, so this is my occupation-based kit, and I hope that it helped you, and I hope that you enjoyed this video, and I hope that this makes taking pills a lot easier to remember or is less painful on you if you have anything that causes pain when you are opening pill bottles. Bye!